Where healthcare negotiations now stand. I'm joined by a key participant, Republican Senator Orrin Hatch of Utah, who sits on two key committees, Senate Health, Education, Labor, and Pensions, as well as the Finance Committee. Senator, you walked out of the negotiations yesterday saying that you did not think that they were going anywhere and that there were key ingredients in what Finance was working on that you could not support. Can you tell us what were those obstacles?
Yeah, I basically disagreed with the direction it was going, but I didn't mean to cause such a furor. All I can say is I cannot support a government-run plan and placing bureaucrats back here between you and your doctor. I really don't like the idea of an employer mandate, a job-killing employer mandate that basically is going to hurt a lot of the people in the lower income spectrum, people who really need those jobs, but they're going to lose them if we go to that. And then, of course, they're trying to do a Medicaid expansion that literally would transfer somewhere near 119 million people from private insurance into Medicaid. And this is the government that now has Medicare, $39 trillion in unfunded liability. Why would we do that? But, you know, I still want to pay a tribute to Max Baucus, the chairman of the committee. He's working very hard to try and come up with a bipartisan bill, but I just thought it was the honorable thing to do, since I can't agree with some of these provisions, you know, to not be part of it.
And it's your understanding that those provisions will definitely be in whatever comes out of Senate Finance?
Well, I believe they will. Those provisions are big provisions in both the House bill and the Senate Help bill. And those are very, very partisan bills that have been done for the purpose of, I think of putting the crunch on Senator Baucus and bipartisan members of the Finance Committee. And frankly, I'd be very surprised if those three provisions aren't major parts of health care, which means that we're going to have federal government control of health care in this country. And of course, I believe that the far left back here, and that's the majority of Democrats, they really are trying to push us into a single-payer system. In other words, socialized medicine, but let's call it a single-payer system. That's what the president used last night, and he actually was pretty complimentary of it.
But, Senator, one of the things that the president has moved toward, and that was very pleasing to the Blue Dog Democrats in the House, was this idea of a commission similar to perhaps a base closing commission, which would actually make the decisions, take the decisions away from Congress of Medicare reimbursements and Medicare cuts, essentially. Isn't that a step in the right direction as far as you're concerned?
Well, they call that MedPAC on steroids. Can you imagine having people right here in Washington, D.C. tell all our doctors and healthcare providers, hospitals, and people in healthcare what they can and cannot do? Can you imagine
Congress doing that right now? In effect, isn't Congress doing that by deciding what the reimbursement formulae are?
Well, sure, Congress has an obligation to try and come up with answers to these things, but that's far different from getting nameless, faceless bureaucrats back here in Washington determining what can and cannot go on in health care. And you and I both know that one healthcare approach works for one human being and it might not work for another. One pharmaceutical might work for one human being but might not work as well for another. And in England now, they're cutting off a lot of healthcare for people because of the high costs of government-run healthcare. And anybody who thinks that government running healthcare and having a nameless, faceless bunch of bureaucrats here in Washington tell your doctors what they can and cannot do for you, and they think that's a good idea, I tell you, I don't think it's a good idea. I think it's a terrible idea. Now, Congress, our job is to try and represent the people and do the best we can. I think sometimes we do a lousy job, and we're headed towards a lousy job here if we don't watch it.
Orrin Hatch, thank you so much.